The advocacy project I chose was selected in the hopes of identifying strategies to improve the orientation of new graduate nurses. The problem stems from my personal experience. In a hospital, the lack of a thorough and effective orientation for new graduate nurses results in a high turnover rate. High turnover rates negatively impact hospitals by contributing to the nursing shortage, increasing risks of patient safety, and causing considerable cost burdens for hospitals. Due to the nursing workforce shortage and an older and more complex patient population, there will be continued demand for new graduate nurses, which is why I felt it was important to address the high turnover rates. I began my research and identified countless facts and statistics on the topic, including the implications of new graduate nurse retention or lack thereof, especially since employment in nursing is expected to increase another 16% by 2024. That translates to approximately 439,000 new graduate nurse opportunities for employment. Generally, the average new graduate nurse turnover rate from all units of a hospital is 28.9% within their first year of experience. However, depending on the department, some critical care areas such as the emergency department or intensive care unit have an average turnover rate of 39.9% within their first year of experience. Limited retention also increases the number of vacant positions for nurses. It increases the organization's costs and increases the risk for patient safety. Some hospitals have reported that their nurse vacancies are greater than 10% and continue to increase every year. These high turnover rates implicate facilities financially, with an average cost between $49,000 to $96,000 to replace one new graduate nurse. The high turnover rates reduce quality of care, which is evidenced by the increased use of restraints, development of pressure ulcers, and patient falls. Many would assume these new graduate nurses just don't have what it takes to be a nurse in a hospital. However, many experienced nurses forget the additional struggles many new graduate nurses encounter. One of the biggest struggles for new graduate nurses is the transition to practice period, which occurs when these new graduate nurses move from their roles as students into their new professional roles. This time frame has been identified as a time of reality shock for the new nurses. This reality shock occurs because, contrary to their experience in nursing school, new graduate nurses are expected to immediately manage care for multiple complex patients while learning to organize their new responsibilities, including documentation, answering call lights, working with family members and an interprofessional team, and advocating for their patients. Reality shock results when new graduate nurses do not receive sufficient time to adapt and properly transition to the differences noted in their relationships, responsibilities, and expectations in terms of knowledge and performance. The most effective potential solution was the realization of a nurse residency program. The retention of these new nurses, to retain the new nurses, improvements must be made to their transition to practice period. The National Academy of Medicine has actually called for all facilities to implement nurse residency programs. Nurse residency programs focus on providing additional skills and knowledge facilitated by the support of their peers and preceptorship. They also assist in the development of the 4 foundational skills needed for any new nurse, including communication, organization, critical thinking, and stress management. Research studies have found that nurse residency programs should last a minimum of 6 months in order to successfully prepare the new graduate nurses for their new career. One of the most pivotal components of the nurse residency program is the additional support and guidance provided by a preceptor. Previous studies found that only 10% of nursing leadership felt new graduate nurses were fully prepared to provide safe and effective patient care. Clinical reasoning, which involves both clinical judgment and decision making, is developed over time and is essential for safe nursing practice. Researchers report new graduate nurses have increased rates of errors and negative safety practices, such as unsuccessfully identifying the deterioration of a patient resulting in failure to rescue. Nursing preceptors act as the primary resource for these new graduate nurses during their time of transitional period to transition safely and effectively as professionals. Preceptors are integral for new graduate nurses in that they ensure patient safety, build new graduate nurse clinical reasoning, educate on policies and procedures, and socialize the new nurse to the unit's culture while helping them to develop their confidence, helping them to be less anxious, and enabling them to become more independent and assume a full caseload or workload. To execute the nurse residency program, I have developed 3 action plans. The first plan was informing the administrative and managing personnel of the identified problem and the research solution. As you can see, I've developed a compelling letter with research and statistics for the approval of the program. The second action plan was to meet with the same team. I developed this PowerPoint presentation where I further explained the problem with our facility retaining new graduate nurses and provided them with data demonstrating how the nurse residency program would benefit the hospital. The final action plan was the development of this brochure where I could use as a visual aid either during that meeting I depicted previously or in a meeting where I would meet with the nursing union. I could either use this brochure, the PowerPoint, or both, and discuss how the involvement of the nursing union could provide additional support in all aspects of nursing by incorporating the program to our union contract. There's always going to be someone opposed to a good idea. Some may be opposed because of the financial toll the program may have on the facility. I would inform them that in previous programs with a nurse residency program of 39 new graduate nurses, they calculated $4,142, which went to the incentive pay for the preceptors, and the additional $34,000 for a nurse residency program coordinator. Even with all those additional costs, the program was still cost effective in saving a total of $2,592,000 after the 1 year retention of all 39 new graduate nurses. Some may also wonder if the program realistically improves retention rates. After 1 year of initiating the program, the new graduate nurse retention rates have been shown to increase up to 100%. The application of a nurse residency program is crucial for several reasons, including improving new graduate nurse retention, helping to develop proficient nurses, improve patient safety, and is financially beneficial for the facility. Numerous studies have concluded similar findings from other integrated literature reviews. The key to improving high turnover rates of new graduate nurses is the implementation of nurse residency programs. These programs benefit healthcare organizations with improved retention of competent, accurately trained, and confident nurses, which is directly reflected in the quality of care and patient satisfaction. These are the references for the articles. The objective I chose to reflect on from class was to examine the role of the professional nurse that can apply in order to effect positive change to promote social justice in healthcare access and quality in a highly regulated healthcare delivery system. And that's it.